Give me just a moment. I have a PowerPoint to share. I think I'm going to be able to do this. Sorry, y'all. Why in this moment am I? Here we go. Are you able to see my PowerPoint?
Yes. Yes,
okay.
We do.
I can no longer see myself, and so I will trust that you can see and hear me now that you've confirmed that. So thank you for this opportunity to speak with you today. I wanted to just acknowledge that I am affiliated with the Association of Black Psychologists, the president of our Greater Sacramento chapter. I'm also the president and one of the founding members of Safe Black Space. It's from that place that I am going to be speaking with you today, along with other experiences that I have. I want to start by just acknowledging that we have problems. My colleagues have done a fantastic job, so I'll be able to move through some of my slides probably pretty quickly. But we have problems that are deep, long, and structural within the United States, and it's things that we cannot deny. When I think about reparations, just in terms of acknowledging where I'm sitting around this, it's connected to this broad understanding of the history that we have experienced, the wrongs, the harms that have already been addressed, that Black people have experienced for hundreds of years by no fault of our own, and understanding that that legacy of enslavement, it still is present with us. And so reparations are about how do we correct those harms, knowing that they are still present for us in contemporary times. We also want to acknowledge that the harm didn't end just because the enslavement process did for us. We know that disparities continue to be prevalent in our experience, and that we are at the bottom of every quote unquote bad list when we really take a hard look at what's happening within our country. Enola shared this earlier, this quote around somebody told a lie one day, and I'm going to just show this brief video. I'm sure people are familiar with it, but just to re-ground us in what Reverend Dr. King shared, over 50 years ago, and what is still present for us. Queenie, I think you were going to be able to share that video.
I come here tonight and plead with you. Believe in yourself and believe that you're somebody. And as I said to the group last night, nobody else can do this for us. No document can do this for us. No Lincolnian Emancipation Proclamation can do this for us. No Kennysonian or Johnsonian Civil Rights Bill can do this for us. If the Negro is to be free, he must move down into the inner resources of his own soul and sign with a pen and ink of self-assertive manhood his own Emancipation Proclamation. Don't let anybody take your manhood. Be proud of our heritage. As somebody said earlier tonight, we don't have anything to be ashamed of. Somebody told a lie one day. They couched it in language. They made everything black, ugly, and evil. Look in your dictionary and see the synonyms of the word black. There's always something degrading and low and sinister. Look at the word white. It's always something pure, high, and clean. But I want to get the language right tonight. I want to get the language so right that everybody here will cry out, yes, I'm black, I'm proud of it, I'm black and beautiful.
Yes, yes, yes. Right? What if we we're able to engage with that sense of loving ourselves and understanding this story, this lie, this narrative that has been told about us, about our history, and about who we are, right? Again, a little bit of checking in about some of the history that we already know about, but Alice Walker has a quote that says, "Healing begins where the wound was made." And part of this story is us redefining the story of who we are in that narrative, but also being willing and looking at all of the wounds that have been a result of our enslavement process. And we see, right, the manifestations of this anti-Blackness throughout our experience of chattel slavery. This was referred to earlier, but this idea of the psychology of oppression, that there has been a very intentional method to use that lie and that story about our inhumanity and ways in which it has impacted us and the ways in which we connect and interact with each other, historically as well as presently, right? So understanding all of the things that were taken from us in terms of our language, our values, our families, and the elevation, instead of our experience, of the European, the white, the colonizers' experience. And in doing that, the ways in which we may have internalized that messaging, created this experience of divide and conquer, with us not being able to come together. And then realizing that this is our history, right? As the United States, that 40 of the 56 signers of the Declaration of Independence owned slaves, that 10 of the first 12 presidents owned slaves, that we were not considered a full person, and that this is the legacy from which we have emerged. We know that systemic racism, institutional racism, is grounded in this hierarchy of white supremacy, this belief that the white race is advanced and more advanced and superior than Black folks. And that has been baked into everything and every institution. Right, it's all kind of boils down to these beliefs and the ways in which institutions continue to carry forth these belief systems. And that steam, some of that smoke that's coming off, is still wafting present in our lives. As we consider our history, this has been well covered by some of the other presenters, but just acknowledging what we have been through the enslavement, the chattel enslavement process, the terrorism that we experienced through Jim Crowism, in addition to the things that we are experiencing even now, right? The school to prison pipeline, police brutality, and then of course, COVID-19. We understand that racism is a pandemic too. My colleague, Dr. Jackson, talked about this as well, but how it is a virus and it is making us sick. We often are aware of post-traumatic stress disorder, those of us who work in the mental health field, but the layperson is very familiar with this term of PTSD, right? We experience something or have had a serious threat to our lives, and we can manifest symptoms of PTSD. We're very familiar with that, right? And part of what we are discussing today is the understanding that trauma is experienced as well because of the historical anti-Blackness in our lives. This image may be, again, something that folks are familiar with, have seen before, but just to note, we see in 1814 an enslaved person, likely being, it's actually from the Legacy Museum, but an image of an enslaved man potentially being kidnapped and trafficked from his homeland. In 1914, we see an image of a man being lynched. And then in 2014, it's the chalk outline of our brother, Michael Brown. And so the insidious nature is that this is persistent, showing up perhaps in different ways than what it was in 1814. My esteemed colleague, Dr. Joy DeGruy, who just presented, has work as well as Naeem Akbar and others, but who talk about this concept of, rather than PTSD, post-traumatic slave syndrome. The understanding that because of the hundreds of years of our chattel enslavement, that has resulted in different ways that we have learned as Black people to adapt, and ways in which are not helpful, that are harmful to us. It leaves us as well with this idea that there's nothing post about our experiences, as others have highlighted, that our experiences of racial stress and trauma and racism are constant, persistent, and leaves us frequently questioning, am I next? Am I next in whatever capacity that that abuse or that racism or perhaps death may occur? And it's me personally, but perhaps my loved ones, my family members, and the idea as well of how intergenerationally the messages, the experiences within our bodies even continues. Dr. Erlanger Turner has a specific definition of Black racial trauma. He describes it as experiencing psychological symptoms, anxiety, hypervigilance to threat, or lack of hopefulness, right, about the future because of repeatedly being exposed to racism, discrimination. And again, it can be something that directly has happened to me or something I witnessed, things that we see on social media. And so the impact can be present in our lives because of all the things that we are seeing and witnessing. We also know that the symptoms of trauma can be experienced with us as individuals, right? The ways in which we see symptoms of trauma showing up in our lives, nightmares, addictions, hopelessness, numbing ourselves out, insomnia. I'll share with you in a bit a little bit of my experience with Black racial trauma. But we also have to understand that there is this collective, historical, intergenerational experience as well. What I want to offer as I continue is I really appreciate the presentations and the slides provided by previously, and hope that you can also appreciate just a more community-based level of looking or thinking about some of these issues as well, right? Being able to see the impact of this trauma. I mentioned at the beginning that I'm one of the founding members and the president of Safe Black Space. It's an organization, a nonprofit that is based out of Sacramento in California that really grew out of the killing of Stephon Clark here a few years ago. We emerged, I frequently called the emotional emancipation circles, kind of were the grandbabies, or we emerged out of some of that work. But related to that, we do community healing circles for Black folks, designed to have us understand some of the impacts of Black racial trauma and to help heal ourselves through this process. We ask a question at the end or in the middle of each of our circles, and one of the questions we ask is, how are you feeling about racism, about Black racial trauma? And you see here just a configuration of some of the feedback that we've heard from our participants. I know what stands out for me, big and bold right there, is sick, right? We see sick, confused, angry, mad, bruised, drained, anxious, defeated, many of the other things you may be able to make out for yourself. But the experiences that we have real, they are fresh, they're very present in our lives as Black people. I wanted to just take a moment and to share a little bit about my experience with racial trauma. I mentioned that I do work here in Sacramento, which evolved out of the killing of Stephon Clark by the Sacramento police a few years ago. But I really have been doing this work for a long time, and was doing work with the Association of Black Psychologists and Community Healing Network, related to helping folks across the state of California get trained on the emotional emancipation circles. It was during that period of time, you all may remember, in 2016 summer, when Philando Castile and Alton Sterling were killed like back to back. And for me, it was completely overwhelming. There were just a few days at a time. I couldn't sleep, I couldn't eat, I couldn't concentrate. And literally, I was having early morning awakenings for 2-3 days in a row. On about the third day, so that means I'm waking up at like 4 in the morning, can't get back to sleep. I decide I'm going to get up, right? This is ridiculous. And in that getting up and just opening to what I was experiencing, it was this extreme outpouring of grief. I cried and cried. I bawled. I wailed. I was tapping into the unresolved grief for myself, but I believe all of our ancestors and those who have passed or been killed or impacted by trauma that we have experienced. I literally could not go to work. I had to call in sick, or in reality, I called in Black, right? As a result of being Black in white America and experiencing these things. When I finally stopped, maybe midway through the day, I had this memory, this understanding of a Tongan quote that says, warriors cry to heal their souls, to cleanse their souls. Warriors cry to cleanse their souls. And it was at that point I stood up, I got up, found my power, and began to continue doing this work. And it's, again, not necessarily that easy, but just an understanding of how this can show up in our lives. And regardless of our backgrounds, our degrees, as a psychologist, I was experiencing my own trauma and have been re-traumatized by other experiences. I think this image is just a powerful one to consider the impact of Black racial trauma, the ways in which it can impact us within different generations, within our own household or family, regardless of our gender, that we all, and even with the videos Dr. DeGruy was showing, that as little ones, as the babies, that we can all and are impacted by situations such as these. And of course, we know social media, all the access and exposure creates an even deeper level of intensity of its impact on us. This is another just visual image of understanding at its roots how our enslavement process is historical as well as contemporary oppression and racism that we experience does impact many of the systems and the ways in which we interact, potentially even with each other, right? The intergenerational nature, it's disrupted our family systems, right? And again, rooting back to the idea that we were ripped from each other, from our homeland, and how that shows up even now in our inability sometimes to connect with each other, but definitely in our mistrust of the systems which have been abusive towards us. And then the potential impact as well of internalizing all of the messaging and how that can show up in our devaluing of ourselves, our beauty, but also potentially in violence within our communities or within our homes.
Dr. Higgins, can you take a few minutes to close?
Sure. So yes, let me move quickly. This is just a study. It was done in 2013 to 16 related to police killings and Black Americans identifying mental health. Again, I want to just acknowledge that our policing, our law enforcement emerged out of the slave patrols. And so there's a clear connection there, but this particular study looked at Black men or women, Black Americans, who had been killed within states within the past 3 months. And what they found is Black folks had more not good mental health days as a result. White folks were not impacted in the same way. My colleague spoke about, it's been mentioned a few times, drapetomania, and just understanding the history of mental health and psychology, psychiatry in particular, and the idea that we were diagnosed as being quote unquote crazy as a result of our desire to be free. I also want to just note that the connections between what has happened and what is happening and its impact on our lives. We also have covered previously the trauma cycle and the importance of Sankofa, returning to what we know to be true about ourselves. I want to acknowledge that how we heal is going to be important as we do that from our own perspective. We must reclaim our dignity, our humanity, and address this trauma very directly. As has already been mentioned, there are a number of healing circles and spaces and resources that can be available to do that, but we have to do the work by us and for us and not from a more Western frame of reference. In closing, I have maybe a couple more slides. This last one is just to consider this idea of the metaphor of healing in a physical injury. That if we had been stabbed, as we might imagine this person has, multiple times and needed treatment, it would be important, and we sought treatment, let's say metaphorically, right, at a hospital setting. It would be important for us to get the treatment that we need, and it may come in lots of different forms, right? We may need a surgeon to repair ligaments that have been torn. We might need a nurse to attend to our care. We may need a pharmacist to provide medication for us, a psychologist to do therapy. It's an all-inclusive process for us. And when we think about reparations, that's what it should look like as well. The mental health and healing perspective is key. And coming from that, from an African-centered perspective in particular that's culturally relevant, that hits the individual as well as the community, in addition to systems, is critical. Land transference, housing, financial restitution, all of those are additional opportunities to treat these wounds. And then, of course, considering the compensation, how might we consider that based on the history and the wrongs? In closing, regardless of however this unfolds, I have hope and trust that reparations that we are due will be paid in some capacity. But regardless, we have got to take care of and love on each other. That is where the medicine truly lies in our healing. In closing, I believe that reparations should be targeted towards descendants of non-immigrant Africans in America, folks of African ancestry in the U.S., because we know the injury is real. We've talked about that history extensively. And this idea that to not provide reparations would indeed perpetuate this belief, this narrative, this story, the lie that Black people are not human nor worthy. And I'll close with this quote and encourage each one of us to take this into consideration from Nelson Mandela. To be free is not merely to cast off one's chains, but to live in a way that respects and enhances the freedom of others. And with that, I will concede. Thank you.